Interstitial cystitis, bladder pain syndrome is a condition that causes long-term pain or discomfort in your bladder and abdominal area, along with urinary frequency and urgency. Healthcare providers don't know what exactly causes it, but causes may include autoimmune diseases, allergies and issues with your bladder lining. Symptoms and causes. What are the symptoms of interstitial cystitis, bladder pain syndrome? Symptoms include 1. Pain in your bladder region. 2. Pressure or discomfort when your bladder is filling. 3. Urinary frequency. 4. Urinary urgency. 5. Only peeing a small amount. Interstitial cystitis, bladder pain syndrome symptoms vary among people. They may be mild or severe. They also may be constant or only appear occasionally. If you're a woman or person AFAB, your symptoms often get worse when you're menstruating. Diagnosis and tests. How is interstitial cystitis, bladder pain syndrome diagnosed? There aren't any specific tests to diagnose IC, BPS. However, a healthcare provider will order tests to rule out other infections or conditions. These tests may include 1. Medical history. 1. Your provider may ask you to record your symptoms in a diary. 1. They may also ask you to record what you drink, how much you drink and how much you pee. 2. Urinalysis, urine test. 2. You'll provide a pee sample for your provider. 2. They'll examine your sample with a microscope and look for blood in your pee, hematuria, and signs of an infection, such as organisms, germs, pus or white blood cells. 2. Your provider will prescribe antibiotics to treat any infections. 2. If your pee is sterile weeks or months after treatment and your symptoms remain, your provider may diagnose interstitial cystitis, bladder pain syndrome. 3. Biopsy. 3. Your provider will first sedate you, put you under, with anesthesia. 3. They'll then use a thin needle to take a tissue sample of your bladder wall and urethra, the tube through which pee passes out of your body, to rule out other conditions, including bladder cancer. 4. Cystoscopy. 4. Your provider will examine the inside of your bladder with a cystoscope to help rule out bladder cancer. 4. A cystoscope is a thin, lighted tube with an eyepiece on one end. 4. Your provider will gently insert it into your urethra up to your bladder. 4. They'll look at your urethra and bladder through the eyepiece. 4. You won't be under anesthesia during the procedure. 4. However, if your provider orders a bladder biopsy along with a cystoscopy, it may require anesthesia. Management and treatment. Diet changes. Some people who have IC, BPS report that certain foods and drinks worsen their symptoms. Triggers. Keep a diary of what and how much you eat and drink each day. Noting what you eat and drink before the onset of symptoms and/or a flare-up can help you learn what foods and drinks to avoid. If you notice that acidic foods or drinks, citrus fruits, peppers, carbonated beverages, tomatoes, cause flare-ups, your provider may recommend taking an antacid with meals. Antacids reduce the amount of acid that gets into your pee. Common foods and drinks that may cause IC, BPS symptoms include 1. Alcohol. 2. Artificial sweeteners. 3. Caffeine. 4. Carbonated beverages. 5. Chocolate. 6. Tomatoes. 7. Fruit juices. Your provider may also refer you to a dietitian to help you create the best diet to reduce symptoms. Physical activity. Exercise and physical activity may help relieve your IC, BPS symptoms. Examples of exercises include 1. Walking. 2. Bicycling. 3. Gentle stretching or yoga. Reducing stress. If you have IC, BPS, stress may trigger flare-ups. Learning to recognize and manage stress may help alleviate your symptoms. You may need to talk to a mental health professional to help with this portion of treatment. Physical therapy. Your pelvic muscles hold your bladder in place and help control when you pee. Exercising, stretching and especially relaxing your pelvic muscles may help reduce IC, BPS symptoms. Your provider can help ensure you're performing these exercises correctly. Many people work with a pelvic floor physical therapist to make sure they're relaxing their pelvic floor muscles enough. Bladder retraining. If you have bladder pain, it's easy to get into the habit of using the bathroom as soon as you feel pain or urgency, even if your bladder isn't full. Your body may get used to going to the bathroom often. Bladder retraining helps you overcome this habit by helping you hold your pee for longer periods. To practice bladder retraining, keep a diary of how often you pee and how often you have the urge to pee. Use your diary to help you gradually increase the time between bathroom breaks. Oral medications. The following oral medications may help treat IC, BPS symptoms. 1. Heartburn medications. 1. Over-the-counter antacids, Tums, Rolaids, may help reduce your symptoms by reducing the amount of acid in your body. 2. Antidepressants. 2. A low dose of a tricyclic antidepressants such as amitriptyline, Irritable, may help reduce pain and reduce urinary frequency. 3. Hydroxyzine. 3. Histamine may cause IC, BPS symptoms. 3. Hydroxyzine is an antihistamine that helps remove histamine from your bladder. Why does my bladder hurt? As the bladder empties during urination, the muscles contract to squeeze the urine out through the urethra. Several different bladder problems can cause pain. The 3 most common causes of bladder pain are interstitial cystitis, urinary tract infection, and bladder cancer. If you are new at our channel, please subscribe our channel. It will be great support for us.